Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
For this week's Health Matters, we are sitting down with Dr. James Geyer, the Medical Director of the Institute for Rural Health Research of the College of Community Health Sciences. And today we're going to be talking about the sleep apnea clinical trial and its primary goal. Thanks for joining us today, Dr. Geyer. So what can you tell me a little bit about this clinical trial?
So the primary problem with sleep apnea is the tolerability for treatment. So many patients require CPAP, which is a mask that you have to wear at night. Most patients tolerate it well, but there's a number who don't. And there are several medications being studied to try to treat obstructive sleep apnea and its associated problems. This trial we've just started is one of those.
So it's trying to move away from or give alternatives to the sleep machine.
Correct. It's trying to provide alternatives to patients that are more tolerable for their lifestyle.
Absolutely. I definitely have a few family members that have to use a sleep machine, but they always don't like it, or they always look for different resources. So what would people need to know about this trial?
The present trial requires a combination of both obstructive sleep apnea and hypertension. Actually a very, very common combination of disorders. And the primary thrust of the trial is to treat the hypertension and the effects of sleep apnea. So it's a double treatment with one agent.
Is there a certain kind of person you're looking for to go into this trial?
There are a number of what we call inclusion and exclusion criteria. So you have to have a blood pressure in a certain range, you have to have sleep apnea in a certain range, you have to have a certain set of blood work criteria. So yes, there are a lot of issues that go into it. They're probably a little bit more complex than we should go into in this discussion, but to give you a general idea, the inclusion and exclusion list is over 2 pages long that we have to go through to see who might be a really good candidate for this study.
So what do you hope to come from this study?
The primary thing is, number one, to prove the safety and the effectiveness of the medication. We want to make sure that it's not causing a problem. We want to make sure that it's helping either the blood pressure or the sleep apnea, but hopefully it's helping both.
And you mentioned blood pressure, so how does all of that work together?
That is an interesting set of issues that arise. But when we go to sleep, our blood pressure is supposed to drop on average about 20 points on both the top and bottom number. If you're having abnormal breathing, the body, each time you have a pause in breathing, releases the equivalent of adrenaline. So your heart rate goes up and your blood pressure spikes up. That's just one time. But if it happens over and over, not only does it spike up and down, but it slowly climbs. And then eventually that blood pressure begins to transition into daytime high blood pressure as well.
Is that why we see older people needing a sleep apnea?
It is more common with age. It's more common with increasing weight. There's a number of risk factors, but it's not really the reason why, but it's definitely an associated problem. Each year older we get, our risk of sleep apnea goes up. Each pound more we gain, our risk of sleep apnea goes up.
Absolutely. And this is more prominent in males.
It is somewhat more prominent. The presentations are very different, and really, unfortunately, women have been ignored to a degree with this problem. The other thing is, just because it's more common with increasing weight doesn't mean that normal body weight individuals can't have sleep apnea. So it's important to not be fooled by the general aspect and keep in mind it can happen to anybody.
So how long has this trial been going on?
Just a couple of months. Very short trial, though.
Yeah. So when will it end?
These trials are without a specific end date. It's when they reach the number of patients nationally that they're looking to enroll. This one is only enrolling 40 people in the whole country, though. So it will probably fill up reasonably quickly within the next few months.
Yeah. So how do y'all, with the population, so it's kind of from all over. So are y'all looking at anything of like rural or city comparisons?
Not in this initial study. That will be in their follow-on studies. So this is what's referred to as an early phase trial.
Okay.
They're looking for safety and they're looking for dosing type information.
What you think is a major misconception about sleep apnea?
Probably the biggest one is that you have to quit breathing to have sleep apnea, and you don't. The actual name of the disorder is much longer. It's obstructive sleep apnea hypopnea syndrome. The word hypopnea means that the breathing is not sufficient for maintaining sleep, or the oxygen drops with it. So that's probably the biggest one. Well, potentially tied with you don't have to snore to have sleep apnea either. You can be what's referred to as a silent apneic.
So how do you know to see the signs?
You have to look at the big picture and not focus on do you snore or do you quit breathing, but looking at tiredness levels and sleepiness levels that are inappropriate. Now, if somebody works very long shifts and they're tired in the evening, that's normal. If you're tired when you're first getting up after 7 or 8 hours of sleep, there's probably something wrong with that sleep. And the question then is, what? It doesn't have to be sleep apnea. There are many things that can make you sleepy.
Absolutely. Or is there anything that I haven't asked that you would like to add?
I think the biggest thing is recognizing that sleep apnea is not a social inconvenience. It's not a disorder that is just about tiredness or bothering people with snoring. It raises your risk of heart attack, stroke, and even dementia. Mm-hmm. So it really should not be taken lightly.
Absolutely. Well, thank you so much for joining us today.
Thank you.